Hi everyone, welcome to the Nutrition and Surgery class. My name is Kaylee and one of the dietitians at the Toronto Western Hospital Bariatric Clinic. In order for you to have the ability to review the Nutrition and Surgery class information anytime you like, we have divided up the class into video modules. They include Slim Time, your pre-surgery diet, your post-surgery diet, protein supplements, vitamin and mineral supplements, nutrition-related complications, and finally getting ready for surgery. The first time you review these video modules, we highly recommend that you review it in order, but after that, you can watch them in any order you like. Do note that we will be referring to the Eating for Health Before and After Bariatric Surgery manual, so it will be very helpful for you to have it on hand. If you don't have a copy of this manual, please pause the video and download it for free using the link that is here on the slide. You can also access this manual through our website. Simply Googling Toronto Western Hospital Bariatric Clinic, clicking on the first link that you can find, going into our website and finding our manual under the tab Health Information. So now let's begin our first video module. We will start by going through diet phases before and after surgery in detail. Before we go into each diet phase in more detail, here's an overview of what to expect. Every patient is required to go on Slim Time before having bariatric surgery. The length of time that you will be on Slim Time will be determined by your surgeon. You will have your last Slim Time by midnight the day before your surgery. Immediately after your surgery, you'll be on clear fluids, and this will be for 2 days. This will be followed by a liquid diet for 2 weeks, a puree diet for another 2 weeks, and then a soft diet for 4 to 6 weeks. The goal is to go back to eating regular texture diet by approximately 6 to 8 weeks. But do keep in mind that everyone's a little different, so it does take different people a different amount of time to heal and to be able to digest regular texture foods. If your system is not responding so well as you go through these diet phases, for example, if you have nausea or vomiting, this may be a sign for you to slow it down and go back to the previous diet phase for a few days before moving forward. So now let's talk a little bit about Slim Time. Slim Time is your pre-surgery diet, and it is a low-calorie meal replacement that comes in a powder form that you mix with water and drink 4 times a day. Because it is low in calories, and especially carbohydrates, it puts your body in a state called ketosis. Being in ketosis decreases the amount of fatty tissues in and around your liver, and therefore reducing its size. This ensures that the surgeon can perform the surgery safely without the risk of injuring your liver. While on Slim Time, you can also expect some weight loss as well. The surgeon will tell you exactly how long you will need to be on Slim Time for, and this could be anywhere between 2 to 6 weeks. You can find more information about Slim Time in your manual on pages 58 to 64. As mentioned before, you will need to consume 4 Slim Times a day, and Slim Time comes in a powder form that is meant to be mixed with 1 to 2 cups of water, not milk or cream. We recommend drinking 1 Slim Time at breakfast, lunch, dinner, and then having the 4th one as a snack. For example, it could be a morning, afternoon, or evening snack. Slim Time comes in chocolate and vanilla flavor. You can choose how many packages of each flavor you wanted to order. You can also add calorie-free flavors into your Slim Time. For example, baking extracts, Mio, Crystal Light, sugar-free flavoring syrups, such as the ones that they use in coffee shops, or sweetener into your Slim Time. You can also mix it with plain coffee or tea. Just make sure that if you are adding anything into your Slim Time, it needs to be calorie-free. While on Slim Time, you're also encouraged to drink an additional 6 to 8 cups of calorie-free fluids a day. You can have black coffee, caffeinated it's okay, but remember that decaf is still recommended after having surgery. Black tea or herbal teas are fine. Chicken, beef, or vegetable broth that is less than 10 calories per serving and sugar-free jello are also appropriate. There's no limit on how much sugar-free jello or low-calorie broth you can have. However, please note that store-bought broth is still recommended, and it is quite challenging to determine how many calories is in a homemade broth. It is also very normal to experience some side effects for the first 3 to 4 days after starting your slim time diet. This may include hunger, fatigue, diarrhea, constipation, or headaches. It typically takes about 3 to 4 days for your body to adjust to the slim time diet. Some information on managing these symptoms is available on page 63 in your manual. And of course, you can also contact us at the clinic via phone or email. You can find our contact information in your manual or on our website or on the very last module of this class.